Hello everyone, I am Dr. Diron. Today I am going to talk about one of the important topic that we always encounter nowadays in our clinical practice. The topic is gout and gouty arthritis. So we all know why the gout is happening. Here comes. We know that in our body there is something called uric acid in our blood. When this uric acid is becoming higher than the normal level, it goes and deposits in the joints, especially in the peripheral joints, and then it becomes as crystals, and then more and more deposits as crystals, and that causes the pain. The most common joint that people usually get affected is first metatarsal joint of the foot. And also it can be affected. It can affect the knee joint and the ankle joint, especially extensor surface of the body. So we should know why this happened. Uric acid, the normal uric acid level in our body is between 3.5 to 7.7. Okay, that is a normal range. When it goes high, it may go and deposit in the joints and causes the pain. Okay, usually the uric acid is one of the waste product of the urine. Okay, so why the uric acid is in our body is because of it's one of the waste product of the urine, and that uric acid level in our body is maintained by a kidney and the intestine. Usually, when the uric acid goes high, it is excreted by the kidney. Nearly 70% excretion happens by the kidney, and 30% excretion happens by the intestine to the feces. Okay, so when these uric acid levels become high, then the problem starts. So, what are the reasons why the uric acid is becoming high? The first one is overproduction of uric acid. So, overproduction means how? Overproduction of uric acid happens in case of increased cell turnover, especially in case of any lymphoproliferative or any myeloproliferative disorders, any hemolysis, or it's because of any enzyme deficiency. So these are the things happening in our body. It leads to overproduction of the uric acid. One. The second one is less excretion. If there is overproduction, it should excrete to the body, but there must be a less excretion because of some kidney disease, or it could be because of any stone, because of any kidney disease, because of any other comorbidities that affect the kidney disease. So this is second one. The third one is dietary over intake of the purine high diets such as beef, meats, alcohol and beers and etc. So these three, just mentioned it, let's keep this in mind. One is overproduction, second one is less excretion, the third one is over intake. Okay. So because of this, our uric acid level become high and get deposits in the joints. So if this happens, how patient will be presented to you? When the uric acid is high, there are four kind of stages patient will go. The first one is asymptomatic hyperuricemia. When the uric acid is high, we say it's hyperuricemia. The first one is asymptomatic hyperuricemia. What does it mean? The uric acid is high, the patient is asymptomatic. So these kind of patients don't need any treatment, but we have to find out the second cause, whether it's overproduction or because of other kidney disease or because of intake. So we have to correct them. The second stage is acute gout. This is very important to manage. The third stage is intercritical phase. That means it is a period between the first gout attack and the second gout attack. Usually it lasts 3 months to 24 months. The fourth one is chronic tophus. So if a patient is having high uric acid level, a patient will go into 4 stages. It could be asymptomatic hyperuricemia, he may be in that, and second one is acute attack, the third one is intercritical phase, the fourth one is chronic tophus. Among these, the acute attack is one of the important things to manage. So if a patients come with an acute attack, how we are going to treat them? Okay. Usually the painkiller, usually non-steroidal anti-inflammatory drug will be helpful. Usually indocin is the one usually we practice that helps more. But of course we know whenever we prescribe a medication, especially non-steroidal anti-inflammatory drug, we have to see the renal function and we have to adjust the dose. The second one is colchicine is one of the important drugs that keep a role in active management, acute attack. So usually we start from 1 milligram and just according to the patient's pain and all, we have to go for the 3-4 days management. And important thing is we have to check the renal function test to adjust the colchicine dose is very important. When it comes to prophylaxis, it's very important. The third one is corticosteroid injection into the affected joints. This is the acute management. Okay, but is this the only management? No. So this is the acute management, and when you go for the chronic prophylactic management, we are going to start with the health education and lifestyle modification. Advise them and point out the dietary lifestyle, point out to reduce some specific diets to reduce the uric acid. And when we go for prophylaxis, it's very important to start with a long-term prophylaxis. Or usually we can start with colchicine also nowadays used as a long-term prophylaxis. Especially, we have to go for this renal function test to adjust the colchicine dose. The second one is uricosuric therapy. Okay, uricosuric therapy is usually nowadays probinazine is one of the drug that we practice. Okay, so uricosuric acid mean usually it increases the excretion of the uric acids to the kidney. So that's how these drugs work. But probinazine in some conditions is contraindicated, especially in reduced renal function, and also in case of nephrolithiasis cases, it is contraindicated. So be cautious of prescribing the drug. The third, the most common drug in prophylaxis, allopurinol. Allopurinol is one of the most common and important drug, but we have to consider some details regarding allopurinol. Usually, we should not start immediately during the first attack. It takes sometimes nearly 1 week to start this allopurinol, and also we usually start with lower dose. And very important thing is we have to monitor the renal sufficiency here also, because this allopurinol dose also is monitored and changed according to the creatinine clearance rate. So it's very important to monitor the renal function test, and also it's very important after starting the allopurinol, we have to observe and monitor the patients for the allopurinol hypersensitivity syndrome. So, especially for 2 to 4 weeks, patients they may have this fever, rashes, and nephropathy, nephromyopathy, and all they will have as a allopurinol hypersensitivity syndrome. Not every patient, some people have. So, it's very important to monitor people on allopurinol for their renal function test and also allopurinol hypertension syndrome. So this is how we manage the patients regarding the gout and acute gout and chronic long-term prophylaxis. Simply in a glance, when you come with a gout attack, we have to manage according to the presentation, manage the acute gout with painkiller and colchicine, and investigate the patient for the cause of the high uric acid. It may be because of overproduction, it may be because of kidney problems, it may be because of over intake. Investigate, take history, examination, and find out the cause and treat the cause. And also, patient may need allopurinol and also other long-term prophylaxis as probinazine, allopurinol and all. It will reduce the uric acid level as a prophylaxis. One important message is like people who are taking aspirin usually it works uricosuric acid. Actually, it increases the excretion of the uric acid in a low dose, but when you use the aspirin in a high dose, it will stop the excretion of uric acid. So this is important. The people who are having heart problem, who are taking aspirin, is very important, who are suffering with the gout. So hopefully this video is helpful, and I think so, I hope so. So we'll see you in next video. Thank you.